Hello, everyone. My name is Beverly Gourneau, and today I'll be presenting my practicum experience titled Extreme Heat and Community Resilience Supporting ICARP Grant Programs. My practicum experience was an incredible opportunity to work with the California Nurses for Environmental Health and Justice in partnership with San Joaquin County Department of Public Health and the Extreme Heat Community Resiliency Committee. This work focused on climate resilience and supporting state-funded initiatives related to extreme heat. It turned out to be an incredibly valuable experience. I didn't come in with prior experience in climate-related public health work, so it really opened my eyes to how extreme heat affects communities like ours in ways we often don't think about. It gave me a much deeper appreciation for the role that public health organizations play in preparing and protecting communities. Extreme heat is actually one of the fastest growing climate-related health threats in California. This project opened my eyes to how deeply it affects everyday life, from school safety to healthcare access, especially in the Central Valley. In this practicum, I worked closely with interdisciplinary partners to support the ICARP Extreme Heat and Community Resilience Program. Specifically, my work was supporting their efforts related to the state's ICARP grant, which focuses on extreme heat and community resilience in vulnerable communities. This experience gave me a critical look at how interdisciplinary teams tackle major public health challenges like climate change right here in the Central Valley. My goal today is to walk you through the organization structure, the strategic areas they focus on, the operations that support the program, and how this practicum applied to the core concepts from our health science program, and the specific contributions I made as a practicum student. California Nurses for Environmental Health and Justice is a nursing-led organization that focuses on advancing environmental health equity. It was originally founded to address the environmental exposures that often lead to significant health disparities in many communities. The organization works closely with local partners and agencies to strengthen community resilience, especially in areas most affected by climate and environmental challenges. For example, California Nurses for Environmental Health and Justice has been involved in statewide work groups addressing wildfire smoke, air quality, and extreme heat planning. Their nursing perspective really shapes how these policies are created and how they reach vulnerable populations. California Nurses for Environmental Health and Justice also supports ICARP, which is California's statewide climate adaptation and resiliency program. Through this work, the organization contributes to larger statewide planning efforts. Overall, California Nurses for Environmental Health and Justice plays an important role by bringing nursing leadership into environmental health policy and program development, connecting frontline healthcare perspectives with broader environmental and climate initiatives. Our work centered on the San Joaquin County Extreme Heat Planning Grant under ICARP. The goal is to understand community vulnerabilities and how extreme heat affects our most at-risk residents, so we can develop future strategies to prevent heat-related illnesses. This initiative prioritizes populations who face the greatest risks, including low-income families, outdoor workers, older adults, and individuals without reliable access to cooling resources. By identifying these impacts now, the project aims to build resilient strategies that can be replicated across the Central Valley. One thing I learned is that extreme heat planning isn't just about temperature. It affects housing stability, outdoor work conditions, school safety, and even mental health. This grant allows counties like ours to plan ahead instead of reacting at the last minute. To provide the necessary context for my project, this slide summarizes the San Joaquin County Extreme Heat Planning Grant and explains how it connects to the statewide ICARP initiative. First, let's look at the grant partners on the left. This was truly an interdisciplinary effort. My practicum was situated within the partnership between the California Nurses for Environmental Health and Justice and the San Joaquin County Department of Public Health Services Resilience Committee. This involvement of California Nurses for Environmental Health and Justice is key as it integrates clinical knowledge with public health advocacy. The grant itself is framed around two essential elements. It is centered on San Joaquin County, but the strategies we developed are intended to be replicable in other Central Valley counties. Second, there is a strong emphasis on addressing the needs of the most vulnerable populations. This is an equity driven planning effort focusing on low income families, adult, outdoor workers, and older adults who are most affected by extreme heat. And finally, the graphic on the right. This reminds us of the larger picture. The Extreme Heat and Community Resilience Grant has funded planning efforts across 46 communities in 23 counties across California. San Joaquin County is part of this larger state effort to distribute over $32 million in grants to build local climate resilience. This program shows the scale of the state's commitment to addressing climate change through local public health action. My contributions were focused on helping the local partnership fulfill the community needs assessment portion of this grant. Working with both California Nurses for Environmental Health and Justice and the county gave me a better understanding of how academic, clinical, and public health systems work together. Seeing how each partner brings different strategies really helped me appreciate interdisciplinary collaboration. The mission of California Nurses for Environmental Health and Justice is to advance health equity through advocacy, education, and community partnerships. The mission really aligned with my project because extreme heat disproportionately affects low income and agricultural communities in the Central Valley. Their vision is to create safe and healthy environments for all residents, especially those in regions like San Joaquin County who face environmental health challenges. Their service area spans the state, but there is a deep focus on the Central Valley communities disproportionately impacted by pollution and extreme climate events. The organization serves multiple groups, including nurses, healthcare professionals, policymakers, and community members. Their work includes community workshops, public education, advocacy campaigns, and supporting statewide programs like ICARP. These products help communities better prepare for extreme heat and improve overall resilience. For example, the community workshops often include practical resources like cooling tips, emergency preparedness information, or even information about accessing public cooling centers. One of the biggest strengths of California Nurses for Environmental Health and Justice is that it is a nursing led organization. Nurses bring clinical knowledge, direct community experience, and public trust to environmental health work. Working with a nursing led team made me realize how important clinical voices are in environmental health planning. Nurses notice different things, like symptoms, risks, and barriers that others may overlook. Their strong multidisciplinary partnerships across health advocacy and research sectors allow them to turn complex climate and health data into actionable strategies for communities. Internally, California Nurses for Environmental Health and Justice operates with interdisciplinary teams of nurses, educators, researchers, and advocates. Their leadership emphasizes ethics, transparency, and continuous learning. Digital tools and collaborative communication support coordination across partners statewide. This creates a strong foundation for ethical community-centered work. I personally use tools like Miro for data organization and Teams and Zoom for weekly meetings. These platforms made it easy to collaborate even though many partners were in different locations. From the community perspective, the program provides education about extreme heat risks, available resources, and ways to stay safe. Workshops, community campaigns, and resource distribution help vulnerable populations prepare for extreme temperatures. Feedback from participants is used to improve services and address unmet needs, ensuring that equitable access and the protection of community health remain central priorities. In many Central Valley communities, not everyone has AC, cooling, or transportation, so making resources accessible is critical for protecting health during heat waves. From the provider's perspective, the work begins with planning meetings to assess local needs and align goals with ICARP requirements. Teams divide responsibilities, coordinate outreach efforts, analyze data, and use technology for data management and collaborative virtual platforms. Evaluation is ongoing, ensuring programs meet community needs and maintain accountability. I was able to observe how providers balance immediate community needs with long-term planning. There's a lot of coordination behind the scenes that the public doesn't see. My main project involves supporting the interview process for the Extreme Heat and Community Resilience Program. I assisted with outreach, scheduling, and contacting community partners to bring more agencies into the project. This included researching urgent care clinics, child care facilities, and other community-based organizations throughout San Joaquin County to build contact lists and strengthen outreach efforts. Once the interviews were completed, I organized the responses in Miro board to ensure that the data was clear and usable. This process allowed the team to easily review and analyze the information. I also coded the responses to identify common themes related to heat vulnerability and resource needs, which helped the committee pinpoint the largest gaps and challenges faced by community members. For example, one common theme that came up in interviews was concern about vulnerable older adults living alone without reliable cooling. Another theme was the need for more culturally specific outreach, especially for Spanish speaking and migrant communities. From there, I created summary slides for team meetings to highlight the key findings and provide the county with a clearer understanding of community needs related to extreme heat. I also participated in weekly planning meetings with California Nurses for Environmental Health and Justice and San Joaquin County Public Health Partners to discuss upcoming interviews, focus groups, project progress, and overall goals. One challenge the team discussed was the lack of centralized heat illness reporting, which makes tracking local health impacts more difficult. In addition to the interview work, I conducted research on how extreme heat impacts children in California and examined statewide efforts to prevent heat-related illness. This included reviewing which schools follow existing laws and guidelines during extreme events, identifying gaps in policy, and exploring the challenges students face during high temperature days. My findings were summarized and presented to the team to help identify needs and inform future strategies to reduce extreme heat risks for children in our community. My work and participation in the project increased the team's capacity to reach more partners, organize data clearly, and prepare analysis materials. I was able to practice skills learned in the health science program. I applied skills from health science research methods, epidemiology, community and public health, cultural literacy, and health program planning. These courses help me understand community needs, analyze data ethically, and collaborate professionally during my practicum. These skills will directly support my future career goals, especially as I work toward establishing a career in public health. This practicum gave me the opportunity to apply classroom learning to real-world public health work. I gained experience in outreach, planning, data analysis, and professional collaboration. It also deepened my understanding of climate-related health disparities and the importance of interdisciplinary partnerships. This practicum really helped me understand how much preparation and collaboration goes into protecting communities during climate emergencies. It strengthened my professional skills for a future career in healthcare and public health, and I was able to make a solid connection between academic learning and impactful community service. This practicum has been one of the most meaningful experiences in my academic journey. It strengthened my commitment to advocate for vulnerable populations and prepared me for a career in healthcare and community health. It gave me the opportunity to apply everything I've learned in health science to real-world public health and to see how collaboration, research, and advocacy truly make a difference. Moving forward, I hope to continue working in community health and advocating for health equity in vulnerable populations. As I prepare to graduate, I am proud of how far I've come and excited to continue pursuing my passion for helping others through a career in healthcare and community health. Thank you for your time and support. This milestone really means so much to me and my family. Thank you.